Today, we are reviewing the lumbar MRI images of a 50-year-old female patient who presented with low back pain. First, I am starting with the T1 weighted sagittal images. In the sacral region, there is a lesion measuring approximately 5 centimeters in diameter, appearing hypointense on T1. This lesion has caused marked posterior scalloping of the sacral vertebrae. In other words, there is a cupping appearance in the bone due to chronic pressure. This suggests a long-standing compressive effect rather than an acute process. On the same T1 sagittal image, I also notice a thin linear hyperintense signal area in the sacral region. This appearance may be consistent with a filum terminale lipoma. Its hyperintensity on T1 suggests fat content. As we continue to examine the images carefully, we observe multiple nodular lesions in the subcutaneous tissues. At first glance, they may appear incidental, however, their multiplicity is significant. Now I move on to the T2 weighted sagittal images. The sacral lesion demonstrates signal intensity similar to cerebrospinal fluid. This finding supports the lesion containing fluid. Posterior vertebral scalloping is again clearly visible. At this stage, the picture I am considering is the following. A CSF isointense sacculation in the sacral region, approximately 5 centimeters in size, causing chronic remodeling of the bone. This appearance most strongly suggests an intrasacral meningocele or falls within the spectrum of Dural Ectasia. Now I proceed to the axial T2 images. On these sections, the multiple nodular lesions in the subcutaneous tissue are much more clearly visualized. These multiple exophytic cutaneous lesions are suggestive of cutaneous neurofibromas. Here, 2 important clues: a large intrasacral CSF containing sacculation with posterior scalloping, multiple cutaneous nodular lesions. This combination should make us think of neurocutaneous syndromes. In particular, Neurofibromatosis Type 1. In NF1, spinal involvement can be quite common. The most frequent spinal findings include Dural Ectasia, posterior vertebral scalloping, lateral or central meningoceles, foraminal widening, scoliosis, vertebral dysplasias. In this patient, the large sacculation observed in the sacral region may have developed as a result of dural weakness and chronic CSF pressure associated with NF1. Bone remodeling occurs secondary to dural ectasia, and over time, prominent scalloping develops.